Okay, everyone, welcome. Welcome tonight to our Public Safety Solutions Summit. As people come in, they'll be joining us. Again, just a few housekeeping things. If you can just ensure that you proactively mute yourself if you're moving around at any time, if you can turn off your video. Let's just do that proactively for the benefit of everyone. We're going to actually start with a video. This is a video that highlights one of our panelists tonight, one of his organization, Community Shoulders. We'll start that off as people are making their way in. If you could turn your attention to your screen, which you already are looking at, we'll start with this video.
We have issues in our community that can be addressed by us having what I consider community shoulders.
You need addiction counseling, we need behavioral health specialists, caseworkers, social workers, and we can no longer address the community like we did in the 80s and 90s by saying this neighborhood, because we have good people in these neighborhoods who are in need of services before they get into the criminal justice system. So if we get out there and address these people, these families, let's say we develop a treatment plan. Like if I engage this family and I have the education to address this family, and I can sit here with a treatment plan and say, hey, let me go back and call Miss Benson, let me go back and call Reverend, let me do this, and I can do those resources immediately.
Who the hell are we to tell them what they need? They know what they need, so we need to listen to what they're saying. Who are we to say that we better than anybody in this community, that we can come to this community and tell them how to act, how to live, and who they should believe in? We need to sit down together and build something from the bottom, from the roots, and come up. We're coming in here telling them what they need instead of, hey, can you help me? Help us? That's what we need.
Okay, well, good evening, everyone. For those who joined, we were just sharing a short video from one of our panelists this evening, and we're going to get right into it. Our commitment to everyone tonight is to try to start on time and end on time. We've got 2 hours, and it's sure to be an exciting 2 hours. So good evening, everyone. My name is Salah Czpary, and I'm running in the Democratic primary to represent Ward 1 on the DC Council. This evening, we're talking about a topic that affects everyone, every ward, every resident, and every visitor to our community, and that's public safety. We're calling this a solutions summit because I'm hopeful that what we discussed tonight is what we can do together. Yes, we have a panel that's going to be speaking here, and I'm excited to introduce them all to you. But this evening is not really about what I can do or what Jay can do or Monica or Stephen can do, but rather what we can all do together to move the needle forward, making us a safer community. And public safety looks different for each of us. In some neighborhoods, the concern might be having raised sidewalks. In some neighborhoods, it might be dealing with package thefts or break-ins. In other neighborhoods, it is gun violence. And we saw that the other day when this panel was prepping for the Zoom call. Actually, Jay had to dive off of his couch because of a shooting that happened right outside of his house. So the problems we're facing are real, and we want to hear what's on everyone's mind. We also want to hear the solutions people have. And what's concerning folks most. And, we've received a lot of great questions in the registration form, and we're going to address those. But before I do, I just want to take a moment to address a few housekeeping items. Like I said initially, just please proactively mute yourself. And if you're moving around, turn off your video just for the benefit of everyone else on the Zoom. We'll begin the evening with some introductions, and then each panelist is going to share a little bit about the work that they do. And then we'll jump straight into the questions we received. And after those, if we have the time, folks who signed up to speak, we're going to open it up and we'll give everyone 90 seconds to speak. And then Kira, who's on the Zoom, will tell people when they have their time. And we don't want to cut people off, but we want to be mindful of time. So continue to interact in the chat if you'd like to. And we're on Zoom. And so we want to make this as interactive as possible. And so we're going to use a system called Slido to make sure that we can poll and get people to interact, even if they're not speaking. And so for that reason, I'm going to pass it over to Stephen Benson, who's on the call, one of our panelists, and he's going to walk us through Slido right now. So Stephen, if you can take it away.
Gotcha. Good afternoon, everyone. Stephen Benson, great to join you guys. I'm a current Ward 8 resident, but former Ward 1, so definitely love my neighbors out there in Ward 1 and looking forward to this conversation. Are you going to pull it up? All right, cool. So this is how Slido is going to work on your separate mobile device or another screen on whatever you're looking at this Zoom on. You can go to slido.com, that's common spelling, SLIDO.com. And you're going to want to join our code of #264-264. Again, that's 264-264. That will take you guys to the first poll. We're just going to kind of get to know our audience here and see who's in the room. So if you guys can go to slido.com right now and press 264-264 and answer that first poll so we can get an idea of who we have in this audience today based on ward or outside of DC area. So far, we want to get some participants jumping in there. So there we go. It's going to be moving around. We have 11 participants. 13. If we can get everybody to get in there, we have 31 so far here in the Zoom. If we can get the other 20 or so in there. I'm also see Salah that the screen kind of changed dimensions. Okay, there we go. All right, 18 in. So far this is looking where we expected, and this is a public safety solution summit for all of DC and some of our neighbors outside, but 72% are in Ward 1, which is really good to hear.
Thank you, Stephen. So, like we've been saying, we live in the nation's capital. It's a beautiful place, energetic, diverse. But we also recognize that what happens in Ward 1 is affecting people in other wards, and what's happening in other wards is also affecting Ward 1. And so we're welcome everyone that's joining from across the city and folks who are joining from outside the city as well. So I'm going to briefly stop this share, and I'm going to introduce everyone to our panel that I'm very excited to do. So, tonight I'm joined by some great friends of mine who are community leaders that I've come to know and respect and admire for the work they do on the front lines of public safety. I'm a big believer in listening and asking questions, but I'm also a big fan of action. And all of these people we have tonight are here because they do the work and they're people of action. So first with us is Jay Brown from Community Shoulders. Born and raised in Washington, D.C., Jay Brown of Community Shoulders learned at an early age that regardless of where you live in life, your influence on someone, regardless of where you are in life, you're an influence on someone. So he strived to make those interactions positive and long lasting. In 1983, Mr. Brown was a peer mediator as a Crime Stopper, and in 1991, he was hired to be a youth counselor in multiple locations and facilities. He went to school for criminal justice, was a member of the American Red Cross Rapid Technology and Mental Health Assessment Team during Hurricane Katrina. And Mr. Brown worked 20 years in the mental health field, and he is currently a liaison and advocate who has learned the importance of empowerment through individual support assessments. He says, "I understand that these events in our communities seem spontaneous, but they have a story behind them, and if there's a story behind them, they can be prevented. If it's negative, it can be uplifted, and it's positive. It can be uplifted and it's positive. This is my life's investment." Monica Mcqueen is joining us, and she's the founder and president of Conversations That Matter Incorporated. As an entrepreneur, speaker, and youth mentor with 10 years of experience in administration, event planning, and management, Monica utilizes her knowledge, experience, and network to plan, coordinate, and manage events and teams. After the unfortunate death of George Floyd, she accepted the call to create safe and healthy community forums to confront, heal, and resolve community concerns centered around social justice, racism, and police brutality to build partnerships with community leaders, government officials, school boards, residents, and youth. And then finally, we're joined by Stephen Benson. Stephen Benson is a successful public safety expert with over 10 years of experience as a 911 call taker and first responder. His experience includes listening and responding to crisis and crimes of violence, training staff in 911 call taking operations, mental health and crisis intervention response, active bystandership for law enforcement, and fostering stronger community relations with first responders. Stephen has worked with Georgetown Law as a fellow for their Center for Innovations in Community Safety and numerous other local university institutions. Stephen's work has been featured in national publications, most notably the Washington Post. He is a Ward 8 resident, formerly Ward 1, and proud girl dad and husband. So I'm excited to have this panel with us tonight. I'm going to I'll ask each panelist to just share for a few minutes a little bit about their work and what brings them here, and then we're going to jump straight into the questions. So I'll start with Jay. If you could jump in and tell us a little bit about your work and what you're currently up to.
Good evening, panel. My name is Jay Brown. The work we do in Ward 7 through Community Shoulders is investing in the people. We believe in empowerment. We believe in listening and learning and doing assessments, social impact assessments to try to figure out where people are currently, where they are in real time, and address those needs in real time. I'm not going to hold you guys up because we got to get through this process, but Community Shoulders is really focused on public safety through the grassroots lens. And I'll pass it on to Ms. Monica Mcqueen.
Thank you, Jay. Hey, everyone. As introduced, my name is Monica McQueen, and I am the founder and president of Conversations That Matter Incorporated. We initially started in Montgomery County, Maryland, and we have had the great pleasure of working with some school representatives. We've also have worked with the Montgomery County Public Schools and the Montgomery County Police Department from Chief Marcus Jones and the other police officers that are in the department. We have hosted online summits, so what we call community forums, where we bridge the gap between those that serve in the Montgomery County public system and in the police department. And we've also been able to bridge the gap between community leaders, pastors, and youth of that community. The ultimate goal is for us to spread this throughout the DMV area, right? So it's just not for Montgomery County, but we have definitely seen success in hosting online community forums where people of the community are able to come and voice their concerns. They can ask questions, they can get educated, and then also they can receive the information from those that are in positions such as police officers, those that are in the school system, so that we can work together in bridging the gap and just creating solutions and making that community safer and just making sure that everyone is on the same page.
I'm Stephen Benson, as Salah introduced, Ward 8 resident, former Ward 1. Happy to be part of this panel. Some of the work that I'm currently working on is helping Prince George's County government get a new response, a crisis, mental health crisis response to 911. But I've done a lot of work in the field of first responders, interacting with community, crisis intervention, focusing a lot on harm reduction these days. But I'm really glad to be a part of this. I'm gonna minimize my voice and let's just get to this program and hear everyone else's voice. So next we're gonna start with another poll from Slido. So we're gonna really get into Slido today, guys. So we wanna hear from everyone here and just know, what does public safety mean to you? Because as Salah mentioned earlier, it's different to everyone. It's such a broad scope of concerns and situations. So with this poll, please enter a word or phrase as to what public safety means to you. And if you go to Slido right now, we have activated this question. The code is still the same, 264-264. And if we can get some participation here, we definitely want to see what public safety means to you.
And as people respond, I'll open it up to the panel. You know, from your experiences, what does public safety mean? You know, what does our response to public safety look like? And I'll just open it up to respond as people put in answers to the question.
And also just to let everyone know that everything you enter here on Slido is completely anonymous. So definitely feel free to, you know, be honest with us here when it comes to these questions and these polls.
So we're seeing lower gun violence, feeling safe to walk down the street, feeling safe at home. We see good jobs and living wages. We see something community led. We see comfort. We're seeing inclusive. So to the panel, what's public safety mean to you?
Public safety to me is looking in the mirror. We are public safety. When you rely on someone else for your safety, you fail. You're a fool if you rely on someone else in reference to your public safety. I don't care what they're charged with. I'm talking about if they're the MPD, the police department, they're charged with securing your safety, and you only rely on the Metropolitan Police Department, you're a fool. If you rely on me, Community Shoulders, a nonprofit who's out here every day on the front lines, and if you only rely on me for your public safety, you're a fool. We were raised in this community based on hope and handout. Hope is great, it's always good to hope, but safety will not be handed to you. Safety will not be handed to you, and it's something that you need to look in the mirror and ask yourself, what's important to you when it comes to safety? What are your biases? Are you racist? Do you have classism tendency? What's going on with you? Do you have problem with self-restraint? What can I do as an individual? When I had to look at myself first, then I had to look at community. What's going on in my community? How can I assist people in my community? What conversations can we have? What can we learn from? And the universal language here is to have people understanding that it's about them, it's about the community, it's about what do you want individually for your safety, and build on those relationships to try to get something more positive that fits within your capacity. And I'm gonna leave it right there.
If I can ask Monica, based on your experience hosting conversations between community and police and other government officials, what do you hear? What does public safety mean to people? What does it look like?
Thank you. I definitely want to piggyback off of what Jay said. When you really think about, well, for me, when I think about public safety, it really just means, you think about the public. That's in general. That includes everyone. So it's not isolated. It's not a one person's job. The public is everyone. You know, when you post something on social media, that's to the public. So everyone can join in, everyone can make a comment. So when you're thinking about a community, everyone that's a part of that community or the surrounding areas should and have an active role in what happens. For me, and what we have seen with Conversations That Matter is, yes, there's conversations that have happened about police brutality, about racism, and things of that nature. But then there's also concerns about trash that's being left in front of, the dumpsters, about noise complaints and the delayed time that it may take for an officer or someone to come and resolve the situation, or anything that may happen about maybe someone's complaining about someone standing outside too long by a bus stop. Like, who can I talk to about that? So everyone has different experiences based on their surroundings. But what we have seen is everyone has the common need. It's like, you want peace, you want a safe community. You want to be able to rely on those that are serving that community to be able to respond in a responsive time and be able to provide a solution and or being transparent about what they're doing to bring new solutions to those problems. So like everyone is saying on here, real solutions, peace, community safety, those are all the things that I think about when it comes to public safety. But again, it's just not in the hands of one person, it's everyone.
That's excellent, Monica. And I just unpacking what our community has put here. We got 22 responses. And interesting enough, we have one of the two boldest ones that we keep getting is community-led and more police presence. So, the duality of that, what we're saying here is we do want more police presence, but we also just and equally want community-led. And pointing to community-led, I just want to go to our panel again. What is community-led public safety?
Well, community showed us, community-led is addressing the quality of life concerns that individuals have from the grassroots, from the root. So you take success. Success looks different for everyone. So does the quality of life looks different for everyone. So you have some people who may want to get their kids a job. That kid may have a learning disability. So public safety can revolve around that, because that kid with that learning disability who can't get a job may have to resort to doing something that they think they need to do to survive without the proper coping skills. So we focus on like 4 areas. We focus on health, we focus on safety, we focus on security, and we focus on the services that we may need from agencies, government agency, from our Department of Education, from our first responders. We focus on those 4 areas. And but the solutions can't be developed outside of the community without the community's input. You don't know what you're solving. So when you say, hey, let me bring this box of solutions to this community, those solutions may not fit. They may not fit that community. So you have to do some type of social impact assessment to figure out exactly what's going on, from the house to the community to the destinations that everybody's heading towards. And that may be school, that may be work. But if you don't focus on those things, you can't solve anything. And everyone doesn't want to live in a mansion, and everybody doesn't want to get carjacked. So we have to listen and say, okay, what are your goals? How can we assist you? Not how can we solve it, how can we fix it for you, but how can we assist you achieving these particular goals? And for those who we don't reach, we have to understand what we ignore at some point will show up at your door. So we may be secure in our home, we might have our household intact, but if you ignore a problem that you feel like you can assist, don't be surprised when it shows up at your door.
That's excellent. Monica, do you have anything that you want to share on that at this moment?
Yes, I will just say community-led, to me, how I see it is, if you see that there's a need, take action. Of course, follow protocol and, checking with your local county and government and things like that and see what needs to be put in place. But I think of community-led as there were different churches that were in the area that I once lived in, and they would host weekly, or I think it was bi-weekly, food drives for people during the pandemic who weren't able to go to the grocery stores, or maybe they were just impacted financially and they weren't able to afford groceries. So they saw a need, they got involved in the community, and they rallied a group of people who would come and would put together like drive-by grocery pickups and food drives. And there'd be other things, as far as if you see or you're hearing, just talking to people in the neighborhood. It could be maybe you're standing at a bus stop and you see the same people over and over, and you guys are having a conversation and you all are expressing the same concerns. I encourage you to take action. Community-led is you're leading your community. So if you see that there's a need, encourage yourself and maybe others. You're like, hey, we see that there's a need. What can we do? Do the research and then lead your community. Get other people involved instead of waiting for someone else to do it yourself. And then that way you're able to lead the community. So that's what I think of it in that.
And Benson, Stephen, if I could jump in too, I think
Please.
community-led, what it means to me. I mean, I think there's kind of three groups within our ecosystem. We have institutions, and those could be government institutions, the police. It could be nonprofits that are doing social programming. We then have our communities, which are unique and diverse, and we have individuals. And so what I think when people are saying community led, what we're really getting to is people want to have input in how we build public safety. Because for someone who's biking down 14th Street, their input is that maybe they don't want a government vehicle, a police car, or some other vehicle parked in their bike lane, right? And that's something that they're very concerned about. For other people, they may be concerned. Obviously, we have a lot of concern over gun violence and carjackings. There may be concerns over noise pollution from ATVs, and what I think we're getting to is that people want to hear. They want to know that institutions are hearing the issues they have and then responding accordingly. And I think that's part of the process of why we're all here today, is to really start to gather some of this information. What are the issues that are most prominent on people's minds? And then how do we follow that up with effective actions and real solutions? And I think we're going to get to that, especially as we start jumping through some of these questions we received.
But I actually want to ask you guys another question on here. We don't want to ignore this other big one, more police presence. What does that mean to each of you on the panel? Is that visibility? Is that actually a quantity? And also, Salah, I want to hear from you on this as well. And if we could see you too, I know you're sharing screens and doing everything when you speak as needed. So Jay, maybe you, how do you feel about more police presence in Washington, D.C.? Do we need more? What are you thinking, Monica, and also Salah?
When I think about police presence, it's going to be based on community. I can't ignore what, if the Palisades want more police, hey, let them have them. If Ward 8 decide they want to be more focused on community-led, proactive steps from community members and nonprofits, I think that it should be a balance, and I don't think that it should be imposed on the individual. When we're in the community, we identify, we organize, and we put action plans into place. And sometimes it may include police and sometimes it may not. But there is a bridge and a role that police are in that's important to the community. We can't always control how they act in those roles, but we can change the roles that they are in by filling in the gaps. And sometimes that means alternatives to policing, mental health action, nonprofits, de-escalation specialists, and things of that nature in the community. So there are different options, and that looks different for everyone. So I can't speak on what 16th Street may want unless I speak to the individuals on 16th Street and see why they want more police, and if it's beneficial and the data supports it, versus just more police necessarily equate to less crime. I don't agree with that, but that's my opinion and that's my perspective. That's from what I'm seeing in the community. But because I'll have to go back to the fact that if you're in a community and the community is not involved in changing the course of or being a part of their own salvation when it comes to reducing crime, there's nothing that the police can do but respond after the fact.
I think Jay, you touched on something that if the panel will indulge me, we can jump into a little bit more, as these kind of alternatives to police response and what those look like. And one thing that I advocate for is that when it comes to violent crime and responding to violent crime and investigating violent crime, we need the police to be able to do that. But at the same time, and I think your work, Jay, speaks to this, that there's a lot of conflict or issues in the community that aren't necessarily escalating to violence, and so that it's not always an appropriate response to have a police officer for, family disturbance or a mental health call or something like that. And you have spoken to me before about kind of these social impact assessments that you do. How do you meet people where they are and get them the services that they have? And I think one thing that also, Stephen, you and I have talked about is that, after 5 p.m., when you call for assistance, you may not have access to the entire social services network. And so right now, our current system is you only really have either the fire department or the police department. And that may not be the best way to one, use our police resources when we see an uptick in violence, but also in meeting people to get them the right services. So I want to kind of pose that to both of you, to the whole panel to respond to.
I definitely agree. I agree with Jay said and what you just said, Salah, is you would have to go to those communities and find out what their needs are. What does more police presence look like for them? Are they open to a alternative police presence? And what you just touched on, is it more of someone from a different agency? Is it more so from someone that has a background in mental health or, whatever that specific need is? And I think once they determine that, and they also determine, okay, this community, they need X, Y, and Z. Okay, who can we provide? Okay, we know that this agency closes at this time. We need to put other steps in place to make sure that these needs outside of a crime, that they're being addressed. So I definitely 100% agree. I'm definitely glad that we're having this conversation, because there are other alternatives that I believe are possible and can be created if those, which I think from the questions that have been posed and what is being posed right now in the chat is people are ready and they want a solution. We want to have different alternatives. We just have to now get to a place of what does that look like, and then just implement it and go from there.
From my experience, I'm sorry, go ahead. From my experience working, this video right? That's Monica, Steve. Can you guys hear me?
We can see you.
Okay, cool.
Yeah.
All right. So from my experience working in community, everything is not clinical. Everything is not criminal. We have to be very careful, because a lot of people have jumped on a mental health bandwagon. And in our community, putting labels on individuals just because they are responding to a crisis. And that doesn't mean that we want to put a label on them. We're looking at the symptoms of starvation. We're looking at the symptoms of a lack of education. We're looking at the symptoms of these deficiencies in the communities, these lack of investments in the community. That doesn't mean that person is crazy. You're looking at the symptoms of an individual who's not getting the best education, who's not getting healthy food. We're saying that with COVID because everybody was dying from quote unquote pre-existing conditions, right? But we have to also focus on bringing to light that we can work together and we don't have to make a choice. The two biggest blocks that were there seemed like we had to make a choice. Do we need more police, or do we do community led? And we can do both. I'm so consistent in the community. If I show up on the scene, I'll give you a perfect example. I'll go back to this one. There was a barricade situation at 40th and Dix Northeast. And I get to the scene, and I was going to try to assist with the barricade. The lady was about 70 years old. And she was having a mental health crisis. She was truly having a mental health crisis. But before I can get to that scene, there was a roped off area where police were manning. And there was another lady who seemed like she was not complying with the police orders. When I get there, the police say, Mr. Brown, do you know her? I said, I don't, but give me 5 minutes, please. And I don't want to, hinder whatever it is that you're doing, but just give me 5 minutes with this woman. I determined right away, based on my history, this lady was having a diabetic episode. She wasn't just not compliant because she was being vulgar and nasty and things. And she was actually having a medical condition. And I was given that opportunity to step in, do an assessment, and get her the medical treatment that she needed. And if I was not there, those police may not have had the time or the capacity to address that from a medical point of view. But they gave me the opportunity because I was consistent in the community. And that's what it's about when you're saying working with another agency. So you don't have to choose between community-led and MPD. There's actions that can be taken in a responsible way. That's what filling in the gaps is all about. And that's what Community Shoulder does.
So to that point, I'm going to open it up to the group again with another poll. So the poll should be live right now, and I'm going to share my screen once again. And this poll is what services do you want to see in the 911 network? So when we started this off, we asked people, what does public safety mean? A lot of folks were responding that, gun violence, when we got the initial registration, majority of people were concerned about rising gun violence, carjackings, and whatnot. And in some of the questions, we're going to address strategies to address gun violence. But one of the ideas here is that if we can reduce some of the workload off of MPD by having nonviolent conflict resolved through other means, then the police can be laser focused on violent crime. And so that's where this poll question is really getting to, is what are the other services? If you come across someone in need and there's not a crime being committed, but the person's in some type of crisis, it doesn't seem violent, and you call 911, what are the services that you would like to be able to call upon to get people help? So we'll let this populate for a bit. We see mental health support. We see the right help, which I think gets to the idea of how do we make sure we have the right tools, substance abuse response, family support services. We're seeing mental health training, suicide intervention. So it seems that mental health is a big piece here. We see conflict intervention as well. And I'll let people put in a few more ideas. And as they do, if the panel wants to kind of respond to some of these, and the context that I'll put here is that right now, for almost 2 years, we've been talking about reimagining and rethinking public safety. And we use the term public safety because it's so much broader than just policing. It's all the entire system to be able to meet people in their times of need. And, as I mentioned before, when you pick up 911, you still only have really the option of fire and EMS and the police. And so what we're trying to get at here is what are these other options that we're looking at? And so we see cross-agency knowledge, we see additional staffing, and there's another one for substance abuse. So we see a lot. The biggest populated one is mental health and mental health support. So why don't we dig into that a little bit? Stephen, I know you have some experience in this field, so I wanted to pass it off to you first.
Absolutely. And this is a crucial one, especially with the fact that we're still in a pandemic and mental health has been exacerbated just as a community, as a world, with the economic issues that we're experiencing, people who who are struggling even more now. And then we look at DC as a community, we recognize that DC and how you put it before is a tale of two cities. And we have communities that are suffering and underprivileged in DC, particularly Black and Brown communities in DC. When we look at the wealth gap, the income gap, racially, and the access to resources. When I lived in Ward 1, I could run into a Whole Foods versus right now it's better for me to go to Virginia. There's 2 grocery stores in my ward and the adjoining ward. And that is exasperating people as well, access to food and the struggle with that. But when you talk about connecting mental health response to 911, this is no easy thing. I know DC is in the process of doing that and is slow rolling that out. It's definitely a collaboration with both the police and the fire side. It needs to be taken. It's something that you have to roll out, starting with those low risk calls, anything. And you got to remember, how our system's built now, you're dealing with a call taker that is going to say, hey, tell me exactly what happened, right? And based on what you're saying, it has to be a call that you think you can refer to a person who, and make sure the ambiguousness of the call doesn't have any possibility of danger, and when we talk about danger, I mean, what we have to ask our mental health responders, what is something that you don't feel comfortable responding to, right? And I think when you look at other models across the nation, there's a co-response that I think is very important, is a response that we can mitigate any potential dangerous situations, or things that can escalate to the level of harm. Because the last thing we want to do is, things to change rapidly on the scene, and it's a medical situation now because someone, cut themselves, and we have a medical health professional there who might not be trained to handle that, right? So what I'm seeing in my experience of how this is rolling out successfully, it starts with a co-response, where you have police officers or a police officer working in a team with mental health professionals. When they get to the scene, recognizing that the scene is secure and safe, it's taking a step back and letting the mental health professional work on that scene and help refer the person for help, in tangent with hotlines, because some people just want to be heard. And working at 911, I've dealt with thousands of potentially suicide callers, and a lot of times they just want to be heard, someone to talk to. They're lonely. You see an uptick of this around the holidays, where people are experiencing depression, around holiday season. So, just understanding, is this something we can refer to a hotline versus is this something we need to respond to physically? And, it's a staffing thing as well. You look at the District of Columbia, we had over 800,000 calls. We got to make sure we have staff in this co-response that can respond, like we said, at Sunday at 3 a.m, not just 9 to 5, because not everything fits into that. But yeah, I'm curious to hear from our panelists as well, and you and Salah on this.
Well, I also just want to jump in, Stephen, that, I think it's not even also that controversial of an idea, right? Right now you have police officers and firefighters and EMTs that respond to calls. And if it's a medical call, the fire and EMS will take it first. But if the police arrive, they know that once the experts arrive on scene, that they can step back and hand it over, right? And so we can develop that. And there's other municipalities that are doing that. And the question, to your point, is, how do we ensure we have the staffing to do it? How do we ensure we build out a either co-response or singular response? And then how does that free capacity so that in this time where clearly on this call, a main concern people had is gun violence and carjackings, which I would argue is the responsibility of the police respond to. How does that free up capacity then so the police can be focused on what their true mission is, which is to respond to and investigate violent crime? But with that being said, I'll open it up also to the panel to answer.
Here we go. We're talking about decentering the police and sharing the responsibility with the community and other agencies. That is very important. A lot of the officers that I talked to over the last few years, they don't want to be step parents. They don't want to be substitute teachers. They want to be police officers focused on the laws that are in place right now. Some of them we agree with, some of them we don't. But that's what they want to focus on. They want to focus on the responsibility of being a police officer and some of these other things that we got going on, to share that back with the community, share with other agencies. We talk about mental health. We can focus on mental health when it's a crisis, or we can focus on mental health from the root and try to figure out what do people need, how did they get to this place, and focus on those root causes before we talk about the crisis, because we have a terrible response when it comes to DBH. And we have to be honest when we talk about what our agencies are doing or what they're not doing, because they will get in front of you because they have a job to hold or a perception to push, and they will lie to you about what their capabilities are. That's why I always go back to saying, you are not going to get public safety handed to you without you getting involved. So you have to focus on why this person is going through what he's going through. And that could come from hunger, like Benson said, with our lack of options in this particular community. It could be in Ward 1 where you guys may have money problems, you know, saying that we can't identify with. Somebody put in the chat, what do you do about public intoxication? Public intoxication. Well, you have options. You know, is this person belligerent? Is this person violent? You have to sit up there and make a choice. But if we have police officers that are willing to decenter themselves and they're not a threat to the public, although public intoxication is a crime, but if that police use that discretion to free himself up and there's somebody that can de-escalate that situation, we can go that route. So, but you have to be responsible when you understand, not and knowing, first of all, you can't do it all. We cannot do it all. We talk about, when we talk about the different responses to different agencies, 911 is not only just an agency that responds to 24/7. They're the only agency by law that is required to respond 24/7. And maybe that's something that we need to look at. Having these agencies that are out there not respond when it's convenient, not respond 2-3 hours later after they, you know, some right now, you call it DBH or crisis hotline, they may not get there 2 to 3 hours. But if MPD got there 2 to 3 hours, there will be some consequences. And we need to look at that as well.
Jay, you literally took everything that was in my head. What I was going to say was maybe we need to look into changing the structure of the other agencies that are already in place, because there is a need and we have to be able to fulfill those needs as a community first and foremost, but then on the institution level as well. And even to sorry, I was going to say a title that I should not say. To Stephen's point about offering different alternatives for if a 911 responder, if there's some type of training for that person and they're able to ask certain questions and then they're like, okay, I've answered these questions that an officer would need to know, like, okay, it's okay, we don't need to go. Now this person can direct them to somewhere else. But maybe as a precaution, just depending on the scale of the situation, maybe just go and see and make sure like everything is okay. But everything that you all just said was literally in my mind and what I was going to say. And so I just agree. And I think we're on the right path of making sure that we get the solutions for this community.
And for those residents,
go ahead.
Steve, I don't know why we just keep on, but for those residents and community members who want to get involved and don't know how to get involved, you can reach out to community shoulders. But I also recommend that you reach out to your other agencies in your community that you feel that addresses the quality of life issues that or concerns that you may have, and do some training together on how that response looks, so that you know if MPD shows up and they know who you are, you can say, hey, I know this individual, or I know the symptoms, or I know that this particular drug only lasts about such and such time. Let me handle this. But you have to have some type, or we together, we have to have some kind of training together to know, to have a better understanding of what it is that our qualifications are when we're in community, and know what we expect from each other.
I like what I'm hearing, and I think one of the things that jumped out to me, what you guys shared, is holding these other agencies accountable, right? You know, we see the MPD on Zoom. We walk, you know, we see the chief at MPD, and he's out in the community. But you know, we need to see some more chat with DVH. We need to see some more chat with CFSA, right? We need the folks that we want to be decentering the police, we need them a part of this conversation as well, right? But what we're seeing in community, as what Jay said, is that officers are wearing plenty of hats, right? And too much, you know, 800,000 something calls, less than 20% are really police related. And we need to make sure these other agencies we might have to restructure it. And I can tell you a lot of it sometimes is a liability thing when it comes to these 911 calls. You have to process the call, and you have to send the police, and you have to send fire to board, because if you don't and things go left, that's on you, right? As a call taker, right? So how do we rework the law, like you mentioned, Jay? How do we hold these accountable? How do we restructure it, like you were saying, Monica, so that it is structured in a way that this agency must respond, right? That's really good.
So I'm gonna, Monica, you had something else to say. Go ahead.
I was just going to piggyback off of what Jay said about you suggesting that if people wanted to get involved, that they could reach out to community shoulders. Please do so. But I also just want to say this, that you don't have to have an organization, a nonprofit, you don't have to have a business to get involved in your community. So I don't want anyone to think that, oh, I have to have this LLC or this type of business to get involved. You can just be someone that works in the school, a parent, you could be a student, whoever you are, like, don't let that stop you. I will personally say, when we started having these community forums, we were not a nonprofit organization. We were just a group of people who met in a Slack for Sean King's, I think it was Glassroots. And it was a bunch of people who were just wanting to get together and make a difference. And we volunteered our time and did different things. And we just came together and tried to figure out a solution. And then we just did the research and what would it look like to host community forums? Would certain agencies be open to having community forums with people? So don't, feel discouraged that, oh, you have to have this organization. I just wanted to say that I didn't have one. We have one now, but we didn't have one when we started.
I'm quite sure that that's not what Ms. Mcqueen is saying that I was saying. And I agree with her 100%. This is a title-driven community. This is a title-driven city. So if you're doing work and you just have a homeowners association, if you have a tennis association, however you want to organize, it doesn't have to have a title. And so I agree with Ms. Mcqueen. So if that's how I came across, then I'm glad that she corrected that. But this is a title-driven city, and sometimes the title is bigger than the work that's being done. So whatever it is that you're doing, however you want to put your efforts forward, rather if it's a community or individual, we will appreciate it.
So I'm going to chime in one last thing before we move to our next engagement. And what I also want to highlight for people is, why this conversation is so important. People, like we saw in the beginning, one of the main things people were concerned about was gun violence and carjackings, right? And so what we're talking about in this decentering policing is not removing the police from areas that they're really intended to respond to, the violence, but ensuring that now with less police officers in the city, that we have the ability to have them effectively respond to the issues that they're supposed to. And when we're talking about these alternatives, and Stephen touched on this, at the police department, there is a program, a domestic violence liaison program, where volunteers are trained, civilian volunteers are trained with MPD and a community organization, and they ride with police officers, and on scenes of domestic violence, they then refer victims to services offered in the city. And the reason the department had done that was there's a recognition that, as friendly as you could be, sometimes that uniform can be a barrier. And therefore there's a productivity in bringing other people into the fold of public safety. And so I put that there just to, kind of center our thoughts as we move to the next question. And now we're moving into questions that were submitted as people registered. So I'm going to share the screen again. And then for those who can and participate on Slido, the first question is, how do we move decisions about public safety from feelings and intuitions and toward data-driven and equitable solutions? So everyone on the call, feel free to participate, and we'll just jump into the responses. I'm going to, if you guys will indulge me, go ahead first. I think what's great about public safety and municipal government is that we don't have to recreate the wheel. There are so many other jurisdictions, municipalities that are trying things that we can mirror, and the data is out there. So when I think of, co-response or singular response to alternatives, I think of the STARS program in Denver that's being worked with. I'm thinking of programs in Dallas, and we can mirror off those programs and do them right here in Washington, D.C. And so part of that is just looking at what has worked in other places and applying it here. And I think, the intention behind this question is that, in times of crisis, and I would argue we're in a crisis now with seeing the highest number of homicides in nearly 20 years and a rising gun violence. Sometimes we want to take a kind of a knee-jerk reaction to implement change. And so, I'll open up to the panel. What are your thoughts on how do we ensure that the decisions we're making in public safety, whatever they are, whether it's more police, less police, more services, different services, availability 24/7, changing the structures of current agencies, how do we make sure they are data driven, and how do we make sure they're equitable?
Once again, we go back to, we have 8 wards. We have many different communities in each one of these wards, and we have to focus on what those communities want, what those communities what that community look like. So if you have 15 houses on one block, you really want to communicate. You want to help those 15 houses. You want to help them organize. You want to help them identify, organize, and put action plans together that best fit them. And this is the way that you focus on the data, because now you're getting feedback directly from the community versus any other outside agency. So then you go back to the 700 block of Kennedy Street, and you're like, hey, how are things going now? And you're organizing, what does it look like? Are these resources working for you? So I want to get the data. I want to receive the data directly from the community in small portions so that we can actually see what's going on from community to community. Because one street may want 1,500 police. The community may not want any. So we had to get that data back directly from the community.
So what I hear you saying, Jay, is transparency in that too, right? We have to make sure, that agencies are being transparent and that you have access, the common person, the lay person has access to that.
Right now, what happens is you get when they start talking about crime stats and numbers, you get the chief or you get some nonprofit, everybody talking, well, we're doing, we 40% less here and 30% higher here. And most people be like, what the hell are you talking about? But if you can actually get those stats from this particular block, from these 15 houses and their investment in themselves, and what does that look like? You can't talk about what's not fair if you involve in everybody in the community, because the stats that's been put on us now is based on strategies that's been put in place by someone other than the community. So if DBH or MPD or whoever, they come out with a summer initiative crime plan. When they come back with that data, they want to have that data to align with that summer initiative program. I'm not saying they making data up, but it has to, they wanted to align with that. But in the community, you want to say, oh, I'm not saying that. This is not what I'm saying. I'm saying something different. So I think that data should be more driven, or it should be something that a way that we include the input from the community and what they're saying versus what the data that you're getting from other agencies. Not to keep singling out MPD. It's just easier to say.
I got a follow up to both Monica and Salah. So we're talking about transparency with data, right? What does that mean? How do we do that? Because even we've seen organizations flip data to a conclusion that supports, and I'm not just talking about agencies of the government. It could be the ACLU. It could be a nonprofit. They could say, hey, well, based on this, we think this. Do we just need raw data so we can come to our own conclusions? Is this an independent thing? You know, what are your thoughts there, both Monica and Salah?
I think it is. It comes down to full transparency. People don't sugarcoat it, just give it to us raw cut and what it is. And I think people will have more of a respect level for those that are making the decisions, but will also respect them even the more when they include the people who will be affected by these choices, decisions, changes. But I think it also goes to the point of being able to include the people to be a part of making those changes, not you just taking data and collecting what you think is happening, and you compile the data and say, okay, well, this is what we have discovered, this is what it is, so based on this is what we're going to be doing. It's just like, wait a minute, I wasn't even involved in this. I didn't give my input. Now this change that you're doing affects me in a way that I wouldn't have wanted to be affected. So if someone actually just took the time to actually give that data and they were just honest, I think that would be great. I will say, I'm not sure if MPD has this, but I know in Montgomery County, they have a Citizens Academy. And so you get to spend one day a week. I think it's like 12 or 15 weeks, and you get to see all that happens in the Montgomery County Police Department, how they're trained, the policies, all the information, those things. So you can see firsthand what happens. So, when you're out in the streets, if something happens, you know what to do, what's supposed to happen, if you're supposed to approach an officer, or if you're not, how you're supposed to handle that situation. But I attended one, and they provided so much information for each different area in the neighborhoods, like the rate of crimes and the response times and all those different things. So I think even there's good data that can be shared so people are educated and enlightened about what's happening in their community. And hopefully that will help to spark an interest to get more involved. But then there's the other side of data where people should be included so that they can contribute to that data.
And let me add this. There are trainings. There are a lot of trainings that teach people how to manipulate data to continue their funding. And that's nonprofits, that's government agencies, and the public needs to be aware that people are trained to manipulate data or to give you or to speak certain language to make you feel like one thing is what is happening, and that's not what is reflecting of the community. And you got to be honest with the public. And let them know what's really going on. It's not like, hey, we're failing, and we need to make a change. When our kids are dying, we're all failing. When our women are dying, we're all failing. When our members of our community in general are dying, they've been ran down, they've been snatched out of their cars, been ran over by their own cars, we're failing. And those are not numbers that we should play with or lie about.
So I think that's a great segue into one of the questions in the chat. We had a question that said in 2015, there were 31 violent gun crimes in Ward 1. This year, they've been 80. What's not working? And what are we going to do about it? So I'll address this question first. So I think there's multiple factors, obviously, right? Sometimes we've seen a steady rise in the homicide rate over the last few years. Of course, COVID happened, and that put even further pressure on communities that were under pressure already. But when we come down to the practical question, people are asking, how are we going to get the shootings and the carjackings and the violent crime to stop? And there's several factors here. The first piece is ensuring that our response mechanisms are well staffed and able to respond effectively. So right now, that's currently our fire department and our police department, and then whatever other agencies or responses that we commit to, whether that's mental health response or addiction response or whatever else that's in the 911 network. And then the second piece is, when the police catch a suspect, what do they do? And so there's two pieces there. There's the first piece, which is prosecution. We see right now that the average homicide suspect has been arrested 11 prior times, which is a very stark statistic, right? And then we also see So we see that, and for one reason or another, sometimes they're prosecuted, sometimes they're not, and that could be a reason. There could be a reasonable explanation for that. One reason could be that officers are making arrests based on probable cause, and prosecutors are looking at it through the lens of beyond reasonable doubt, and sometimes that's not going to match up. However, if it doesn't match up, there's also an indication that we should be investing further in investigatory capacity so that the police can build stronger cases that can get prosecuted. And then on the second side, we have diversion, and diversion is when a young person is arrested, that they may be diverted from arrest. And the idea there is a good one. We don't want young people who have made a mistake to then be, live with this consequence for the rest of their life. However, we have to take a look at, are we diverting people based on age or other factors that really shouldn't be diverted? Or are our diversion programs not actually providing them the support so they can get back on the right track? So there's two pieces there we have to have a look at. One, how do we build investigatory capacity to make sure that cases are prosecuted? And two, when it comes to diversion, how are we ensuring that the people we divert are actually getting into programs that are going to bring them back into the fold of productive community life? And so in the meantime, while we have these two things that we're trying to sort out, the prosecution and diversion, we have a set of data that indicates to us that after a certain number of arrests, someone is likely to commit the most violent offense, which is a homicide. And there was a study that came out recently that's indicated that there's 500 identifiable people in our city who are responsible for 70% of the gun violence. And so it's not a large group of people. So we have this set of data. And in the meantime, while we try to solve those two pieces, right, we have to be ensuring that our entire social human support services network is infused into these people's lives, because violent crime is not random. They're upstream failures that cause violent crime. And so while we're ensuring we're building strong cases, while we're ensuring that we're diverting in a way that's meaningful, we should be trying to catch people up on job training, education, helping them get a driver's license, helping them get a bank account, doing whatever is needed to ensure that someone does not become the next person that picks up an illegal firearm and shoots it. And again, I don't think that everyone can be programmed, through diversion or other means, programmed out of that violent behavior. But we have to have a holistic approach to the violence in the community. So I say that to hopefully answer the question in the chat, but I'll also leave it up to the other panel members to provide some input.
I also got a follow-up for the panel members as well. If I'm a young kid, I had some run-ins with the law. I come from a situation at home where, we're underprivileged, right? There's issues there. There's trauma there. I get released because, and what's happening, I'm getting released because my court date is set till 2 years later, and they're not going to hold me because, that's not what they're doing. And I go back to my community that's underprivileged. And people are shooting my community. It's almost a necessity to survive in some ways, where you're like, hey, I got to grab me another gun. I mean, what do we do? I mean, how do we heal the community so that we're not just diverting people, letting them have a weekend great time with this agency and learn a little bit of something, pet some horses or whatever we're going to do. We just put them right back in such and such avenue and street or block where there's issues in that community. There's that community struggling. So, what about those complexities?
I look at the community. I'm sorry, Ms. Mcqueen, you can go. I'm sorry. No, I look at. Let's talk about gun violence. To me, the gun is just a weapon of choice at this time. We can take every gun out of the city, and if the mindset is the same, we're going to choose another weapon. We're going to choose a brick. We're going to choose a knife. We're going to choose our hands. This goes back to thinking about the fact that although things seem spontaneous in our communities, there's a story behind it, and we had to get to those stories. We had to get to those whys on what, when, how can we prevent these things? So when Salah talks about the prosecution part, I'm focused more on let's address some things before they even get to the prosecution period. Let's address those things before they get to the prosecution period. During the pandemic, a lot of individuals lost loved ones and caretakers, people who provided great guidance. And when that mandate was lifted and everybody was brought back into the community, it was almost like people were coming back from a war zone. And we sent kids to school with backpacks, but we didn't help them unpack the crisis and things that they experienced. The data also shows that a lot of these kids in school were abused while they were in the house and during the pandemic. Zoom calls that we were on, the kids was telling us, hey, we need help. We're not even speaking to our parents. We're isolated in these rooms. We're not eating. And we didn't unpack that. And so those are those are the symptoms of a lot of the uptick in violence that we're seeing right now. We failed to help these kids unpack what they were dealing with in those households, because some of them relied heavily on what they were getting in school in reference to meals. They didn't have to choose between, do my little brother eat or do I eat? So there were a lot of things that are contributing. And just because we were traumatized ourselves or those kids were traumatized ourselves, it does not give them, they're entitled to those feelings. They're entitled to the feelings that come with being traumatized, but they are not entitled to hurting other people and other members of our community. And so violence in our community, it looks different. It's not just somebody putting a gun to your head. Violence in our community looks different when we only had 2 grocery stores. Violence in our community looks like when you invest in oppressors versus investing in members of the community and their education and other basic life necessities. So there are so many different things. And I say all of this to say that there is no handout when it comes to public safety, and people need to take all of these things into consideration. And with leadership that has an open mind, instead of trying to force one solution versus the other on our community, is important to look at that leadership and understanding that they understand the complexity of our community. And so right now, that's not what we have. And if we see that person or we focus on that individual that is willing to listen to all aspects of what's going on, then we may be able to develop a better strategy to address public safety.
I flip that, unless you have something to chime in, Monica, I want to flip that to Salah. So we're looking at a complexity here. We have immediate concerns in the community. We have carjackings, we have violent crime that we immediately need to address. But downstream, earlier, we see that these communities are hurt and trauma is begotten trauma, and people are, acting on impulses. It becomes part of culture. How do we address both?
A great question. I think that is the question of the day, right? How do we make long-term investments in broadening education, healthcare, access to resources, while also ensuring that people are safe on any street they walk in our community? Because at the end of the day, if people are not safe or they do not feel safe, that is the number one issue. So I think, I touched on the piece about diversion and prosecution. I touched on the piece about how we make sure we staff appropriately our police department, our other responses, whether that be fire, EMS, and then these new responses that we can create. And the last piece of it is having an intentional plan of investing and broadening out education, healthcare, and all of these other social systems that we have. But the fruits of those programs we won't likely see for 10, 15, 20 years. But the goal should be that anyone in our city, regardless of what neighborhood you're from, can get a quality education, and that quality education can lead to gainful employment. Because if we want to see the reduction of violent crime in significant numbers and a sustained reduction, the only way we can do that is by ensuring people have opportunities to get educated and then to be gainfully employed. And that doesn't discount the need to then, in the immediate time, be able to hold violent offenders accountable, to make sure that they are prosecuted, and to make sure that the community is safe.
I want to speak to something, if I can, getting back to the root of trauma and what we can do to provide healing. I think if we actually take the time, and which I believe that we are and will, is for that situation that was painted for that young man who had issues, you know, the different things and challenges that he was faced with, and then, you know, arrested, and then, you know, he's released. But I think what can happen, or what should happen, I was writing some notes down, is in the process of him being released, or this particular person or an individual, before they get released, what are the steps that are being taken to make sure that this person doesn't repeat the same things? What agencies or nonprofit organizations or people in the community, whether, you know, depending on the person's spirituality, what are things that can be put in place? Because when I think of trauma and healing, I do think of therapy. I do think of a mental health professional. I think of someone, if you have, if you believe in a certain faith, then there's someone that can come in and help you unpack, kind of to Jay's point, what the root of that issue is, and kind of going back to understanding what is the root of the anger and the frustration that would lead someone to pull a trigger or to stab someone, or to pick up a brick, or just to hit someone with their fist. That's just not something that will just come up, just me walking down the street and I see someone and you want to hit them. There are some things that have happened that have led to that situation. So if we could put something in place where there is a group of people that are assigned to persons that are being released, or they've served time, or maybe it was juvie or some type of detention program within the school system, that, hey, so we want to help you. We believe in you, and this community wants you to be better so that you can serve this community better than you left it. Here are some tools. This is mandated, you know, that you have to do, and then keeping that person or persons accountable. But that comes back to who in the community is going to step up and provide these services, or government institutions that we able to provide it. It's just not one-sided, and then just leaving it up to that individual to try and make the changes on their own, because maybe they were never afforded the opportunity to get counseling, or they never had an opportunity or felt safe enough to share their feelings. I'm sure with Jay and that group of persons that, or young people that they were talking to, they felt safe in sharing those feelings, and then felt safe knowing that, okay, Jay is going to probably help or provide a solution. So we need more Jays to be able to step in, but who are those people to be able to provide those services so that we can help turn the narrative around? And then I believe that would lower the number of homicide. And unfortunately, it's not something that can be prevented. That would be awesome. But at least lower it and get to the issue at hand. That's what I wanted to say.
I agree. And going back to Salah, and we discussed this Tuesday, there are a lot of people, matter of fact, everyone in our community has a problem. They may be able to function with their problem, but everyone has a problem. But everybody doesn't want their problem fixed to fit in our society. And those people, they may have to be prosecuted. So I don't want to get away from that, you know. So for those people, they may want to get, because everybody doesn't want their problem fixed. Everybody's problem can't be fixed. And I'll give you, and I realized that I've been giving you a lot of examples of how things can go wrong, but let me share this with you. 3 weeks ago, I talked to a young man. He was asking me, did I know of anybody hiring? But he had already qualified for the summer youth program, or he wanted to get into the summer youth program. His problem was he can't leave out of his community because there's a high probability of him getting killed. So as a solution, I reached out to DOES, and that community that he lives in, I applied to make that a host site for the summer youth program. So he doesn't have to go outside of that program. And one of the things that we're looking at doing during that 6-week program is a GED to UDC pipeline. So we're still reaching out to UDC to try to get them to come on board with, hey, if we can help these young men who are maybe 17 to 19, who they can't even go to the neighborhood schools, but we can get them this GED. So we can get them to UDC. That's hope. You know what I'm saying? That's not handout because they got to work for that. But it was a solution to one of these individuals' problems. But that individual becomes a solution for the community, because now these individuals don't have to go out and rob over the summer. When they're left at home, they don't have to choose, do they eat or do their siblings eat? So that's just something that we've been thinking about.
Thank you, Jay, and thank you to the panel. I want to open it up, where I want to be cognizant of time, and we have just over 30 minutes left together this evening. And so there are people that had signed up to speak, but I also want to just extend the invitation to anyone who's on the call. And we'll to be mindful of time. Kira's on the call here with us, and she's going to be keeping time. So please keep your comments to 90 seconds or less, and she'll stop you if you go over, and then we can continue interacting in the chat. So at this point, open it up to anyone who would like to speak, and when you do, I'll pin you so people can see you, and we'll go from there. Whether it's questions or comments.
I know there's not a quiet group in here when it comes to public safety.
And if there are no questions or comments, we'll go to some of the other questions that we received, and we'll continue to discuss them. But I see a hand is raised, so whoever has their hand raised, go ahead, and you're muted. So.
Yes, hello. Nice to meet you all this evening. I guess I was curious and was wondering, with the current MPD budget, which I'm not aware of what the actual number is, but is there any way to maintain or decrease the police funding and still have community safety in all of these programs? Or do you see it as a reduction as possible, or maintaining the current level, or is a increase in spending possible and or necessary? Thank you.
That's a great question. So currently the MPD, so the city's budget is $19.5 billion, which is a massive budget. And the police budget is less than 3% of that budget. So I think realistically, and most of that budget goes to personnel costs. So I think realistically, the question is not, do we move resources from the police department to another agency? It's with the 30%, over 30% of our city's budget goes to human support services. So how do we use those funds more efficiently? And how are we more innovative with them? And the same has to be done within the police department. But I think in DC, the question is not so much the reallocation of resources from one agency to another, but rather the efficient use of those agencies within their current agency.
Thank you.
Gary, I see your hand is up. Go ahead. And
hey, folks. First, I want to say thanks for the panel. This has been surprisingly very good, actually. I appreciated the ability to talk about this stuff. I did want to address your last point there, Salah, because the question is reallocating funds from some agencies to others. That was the recommendation of the Police Reform Commission, which was the plan outlined by the city, a panel of experts, as a way to build public safety and also to build an off-ramp to the mass incarceration that prompted the protests of 2020. So I'd like to know why, because I know the mayor's trying to increase the size of the police force. I don't think that's going to help. I think that trying to implement the reforms that some on the panel here have recommended is probably the way to go. And I realize that there's some police, there's going to be some interaction, and police are going to have to play some role in all this. But I'd like to know why, if you support reducing the size of the police force, and if not, why are you deviating from the plan set forth by the Police Reform Commission? Thank you.
That's a great question, Gary. So for those who don't know, the Police Reform Commission put out a report, and one of their first recommendations was to have either co-response or singular response mental health professionals, right? And so in 2020, the police department and the MPD had 3,800 police officers. At the time, the budget was cut to stop hiring, and so through resignations and retirements, the department lost about 280 officers and detectives. In the meantime, however, no program has been created to stand up within the 911 network a mental health response or an other type of alternative response. So I think to your point, Gary, it's not that there's a resistance to doing that. I think it's a matter of we have to do it. I mean, we have the ability and the money to do it. We have the ability to put a new service in the 911 network. I mean, right now you have police or fire. It's just a matter of adding another service. And because we did not create an alternative response that could reduce some of the 911 workload off of MPD, that's why the council and the mayor are now putting the city back on police hiring. And I believe we do have to hire police officers because we can innovate and create a new system of response and then collect the data to see how it's working and improve it. And then we can right size all of our agencies to determine how many police officers we need, how many mental health professionals we need, how many fire and EMS and all those other services. But
yeah, I think, and I'll chime in.
Yeah,
I definitely want to chime in too. I think the error is that we didn't replace before we repealed, right? We didn't replace before we took. And I think, we had a lot of emotions nationally about what happened, the murder of George Floyd. And I think cities had knee-jerk reactions. Some might call it virtue signaling. And we didn't look specifically at what was the issue at our city. Instead, I think the city just said, oh, I hear a lot of people down here saying this, let's do this right now. And it takes time to create a total different institution and agency. I mean, you look at the police department in DC has been around since the 1800s, and the fire department's been around a long time. We just can't overnight remove police from community and then create this new thing. I think it was done wrong. I think we should have started slowly creating this agency or whatever it is and how it responds, instituted, and then we replace, because to Salah's point with the article, we have fewer police now responding to the same amount or what we're seeing more violence. So now we have officers, we want to talk about the mental health of officers when they're having mandatory no days off. And DC police officers are responding to every protest in the city, January 6th, and these are not like a new set of officers that you see at the protest. These are officers being stripped from the community to respond to your call to go down to the First Amendment assemblies. So I think there should be a really good assessment of what is that number and how many we need. And I think oftentimes, people will say, hey, well, we have all these different agencies. We're the most police place in Washington, D.C. Well, really, that's far from the truth, because when you call 911, there's only one agency coming. Heck, if someone's breaking into the Capitol, there's only one agency coming. So there's the scope of which this police department is responding is wide. I think everyone is in agreement that we need to create that agency before we just replace things, because now we have the mental health and well-being of these first responders being spent, and now then you run into them in the community and they don't respond the way you like them to respond in communication. I'm not trying to say we don't need to hold officers accountable, but you don't realize that this officer hasn't had a day off in several weeks. So we want to have healthy officers in the community, regardless of what that number is. But I just wanted to add that point.
And let me add to this. These conditions that we're living in now didn't sneak up on us. They did not sneak up on us. Now, I'm not talking specifically about MPD and the number of officers they have or do not have. I'm talking about putting in place alternatives, putting in place or having different agencies. I personally went with my organization, and I know countless other organizations went to each council chamber down the Wilson building in 2018 and 2019, even the current Ward 1 council person. And they ignored what we were saying from the community. We were saying then what we're saying today. About the agencies, getting the other agencies involved, passing laws to have other agencies have to show up by law to have them to collaborate to make sure that the police at these centers, because we didn't feel like it was fair to MPD or the community to have MPD to wear so many hats. So those concerns were ignored. When we sat in front of Brenda Nadeau, when we sat in front of her, she dismissed our concerns. We even talked about something that may have, in Ward 1, I know that you have a lot of shootings in Columbia Heights. We gave solutions. We shared those solutions. We talked about the shelters in the community. We talked about some of these young men and women who are aging out of foster care, who are becoming victims of prostitution in Ward 1. We talked about all those things. Those things were ignored. Those things were ignored by the Ward 1, the current Ward 1 council member. And I just want to let you guys know that on this panel, in this Zoom meeting that live in Ward 1, it wasn't just Ward 7 that was ignored. It wasn't just Ward 5 that was ignored. Ward 1 was ignored. I sat down there myself personally. And so these conditions did not sneak up on y'all community. Just want to say that. Somebody got their hands raised.
Sudeep, your hand is raised.
Well, thank you very much. And this is an incredible opportunity for us to learn from the leaders like Jay, Stephen, and Monica, and also you, Salah. I just wanted to ask a question, knowing that you are a visionary, and I want you to envision that you are the council person. One of the things that I personally feel from a standpoint of our neighborhoods, our community, folks like Monica and Jay and Stephen, they have the heartbeat of the problem in our community. And leaders tend to at least portray during their election cycle that they're understanding what is going on. But at times, what happens is when they make it to where they do make it finally, it seems they lose the sense of how to find systemic and comprehensive solutions. And part of that is because also they let go of those people who build these communities and who sustain these communities and who lead these communities. And my question is twofold, and one particular example I want to provide or give you a scenario. That one of the things I felt deeply is that we are now at a point that the civic sense has eroded to the point that we don't even understand that what civility is. I'm just bringing this as a problem because that in fact impacts public safety. And we don't have structured programs about creating an awareness about the public safety itself. If you go and ask some young men and women, what is public safety, much like the adults here, they don't understand that concept. Because if any efforts are being made, it's through the leaders that are here today. But more importantly, my question is, we are also going to face some challenges in the next 2 or 3 years during the span of, say, your council personship there. And one of the problems is none of us imagined January 6th would happen, insurrection. And Washington, D.C. is so unique that when something happens right about 2.5, 3, 4, 5 miles away from us, there is a greater chance next time the Capitol will be better protected, but our streets, what's the guarantee? And to me, how do you, as a leader and a council person, will continue? What's your vision? What would you do to continue engaging the community, people, families, parents, children, everybody, in saying, how do you even begin to sense the potential risks that you may have to face in your community? And we are already living with carjackings, we are living with gun violence and stuff like that. But these impending, and I'm telling you that no one can say that this is not going to happen at all, because we already experienced something that we never thought would happen on January 6th. How would you, as a visionary, sit there among your colleagues, and what would you do for people like us in the ward to keep us safe?
Thank you for that question. I think you hit on the anxiety that I hear from a lot of people, that people do not feel safe, and more than just feeling safe, I want people to be safe. That requires us to have these conversations, one, to get a pulse on the community of what are people feeling and what are they seeing, what are their ideas and solutions. Anyone on this panel can tell you that I don't necessarily 100% agree with them all the time, right? We're having a robust debate to hopefully have a spark of truth, right, and a spark of action. And that's what I would continue to do with our community. Practically, what I've addressed already is that we have to ensure that we have a robust investigatory response. The data is that there is a small number of people that are responsible for gun violence and carjackings, and we have to ensure that we can hold them accountable. And that's not mutually exclusive from also investing in all of these programs so that we can address trauma, we can address inequity, and making sure that everyone has an opportunity to succeed so that they do not fall down a path of violence. But again, for the members of the community that are very concerned about safety, we have to ensure that we're being strategic and intentional in responding to gun violence, and making sure that people who shoot indiscriminately in the street and make us all safe are held accountable.
Thank you, Salah.
Any other questions?
I think the current climate, and full disclosure, my nephew, Jeffrey Price, in my opinion, was murdered by MPD officers. That never stopped me from doing what was in the best interest of the community as a whole. So I looked at all sides, not just the fact that in my opinion, my nephew was a victim in that particular case. I was also a victim of a home invasion. So I'm not going to turn my back on my people. I'm not going to turn my back on my community. If I see a bridge or opportunity to build a bridge, I'm going to do that. And that's what I have continued to do. With the current climate, like Monica mentioned earlier, and George, sometimes we have these knee-jerk reactions, and they saying that that's the possible case with George Floyd. I don't necessarily agree with that, but what I do know is that we don't have to choose. We don't, as a community or an agency or a council person, doesn't have to choose one or the other. It doesn't have to be one or the other. It doesn't have to be for police and against police. It doesn't have to be safety is determined on police or non-police. If you have that bridge and you're willing to build that bridge, or matter of fact, if you're willing to stand on the bridge that you build, I think that we can look at the entirety of the budget and not necessarily victimize the police every time that we disagree with something. There are procedures in place to address misconduct in office. There are procedures in place to address a citizen who breaks the law. So we don't have to be in that box where we in this corner where, oh God, we need, it's either the police or not. We can work together and build something together. And I think that a great leader will understand that when they're focused on a budget and when they work with other council people, it's not, it shouldn't be looked at as in a punitive way. It should be looked at in the best interest. Where can we pull this money for the police? It doesn't necessarily have to come from education. Can we budget, can we do this with the budget? But that's going to take a great leader to look at all those aspects and not put the community where we're having divisive conversations about how do we choose our public safety when it comes to police or not police.
Thank you, Jay. Any other questions from participants or any questions in the chat if you don't want to speak Feel free to raise your hand and we'll call on you. Or any other comments from the panelists?
I think this was a great discussion. I'm glad that you guys didn't impose any particular position, and for the members of the community, I hope I didn't impose any particular or specific positions. This is something that is going to take all of us, and I really appreciate you guys being here.
Amen. I think we got some new comments in the chat, but additionally, I do like what I'm hearing. I'm loving what I'm hearing across the board. And I think, like, let's look at the whole budget. Let's look at the whole $19.5 billion. This is serious money. And like to what you're saying, Jay, we don't have to pit, one agency against the community, or it has to be either or. I think that's very powerful, that we just need to look at the whole.
Well, I want to thank everyone for being here. I want to thank our panelists, Jay, Monica, and Stephen. As you can see, this is a continuing conversation. There's no way we can wrap up all of our thoughts and ideas in just 2 hours. Our intention is to continue to have these conversations, whether online or in person. Before we leave, since we do have some time, there is another question from John. Many answers about more broad common sense multi-agency. There's a lot of talk recently about an MPD. Okay, so this is a very specific question, John. I appreciate you bringing it up. And I think, I would agree that, an audit on any government agency is an important thing to make sure that first address what is the mission of the agency. We have to define that. And two, is it meeting its mission effectively? But what is also important to understand when we do an audit on any agency is that we have to make sure that the doing of the audit doesn't actually create an additional burden on the agency. So that means making sure it's funded and making sure we're putting in the right resources, personnel, and otherwise to collect that information and to determine whether an agency is meeting its mark. And at the end of the day, the role of the council is to provide oversight to these agencies. So I hope that answers your question. So with that being said,
hold up, Salah. There's a important question here. Somebody asked about school safety. Mm-hmm. And my take on school safety, we have security officers who work in the schools. And a lot of those security officers come from our community. They not only know what's going on in school, they know what's going on. They know that specifically what's going on in those kids' communities. They know what's going on in the house. Some of these security officers are friends with these kids' parents. I think that we should offer these security officers, give them a formal education into counseling and invest in that, have them back into the schools so that we can have a more robust counseling apparatus in our schools. And that, if you want to continue, that would be in place. And if you want to continue to have police or not have police, at least we'll have that in place as an alternative.
Great, thank you. Oh, go ahead.
And I had a kind of, just as we wrap this up, and if more questions come or comments come, great, definitely let me know. But how do we, going back to the beginning, engaging the community, how do we engage the community outside of just who has internet and go on Zoom? Because at the end of the day, we're privileged. Not everybody in our community has access to the internet to be able to do this. And I'm curious to some of the responses that the panel has, because that's what needs to be done next. And also, how do we empower our audience in whatever field they are into moving the integer to public safety just one notch? And we don't have to, one person can't do everything. You're not going to A to Z stop everything, but how does each one of us just move it just one little notch over to where we need it?
So if I may, Stephen, I think that, in talking about moving public safety a notch forward, it can look different in different neighborhoods, right? In neighborhoods where the concern is, how do we increase pedestrian safety? That may be working with a local ANC, local neighbors to advocate for some type of school traffic calming measures, right? In neighborhoods where there's a lot of package thefts, maybe it's working in the block to help install cameras on through the rebate program, right? And then when it comes to issues like gun violence and carjackings, that becomes a lot harder for people to grapple with. Well, what can I really do about this, right? I think part of that role is being part of these conversations, because at the end of the day, a lot of the strategies that we are undertaking as a city, they come from either our council, from the mayor's office, from any of these different agencies, and our voices should be heard so that we can, have input into the strategies that we're taking to combat gun violence, to make a safer city. And it won't happen overnight, of course. And so that's why we wanted to have this space. And to your point, not everyone has access to this space, and so the next time maybe we have to do this in a place that's in person and in a public space, so that we can get more and more voices. But we've started, and we're going to build momentum, and I hope that folks will continue to join along with us. I see there was another comment, and here was some information from Working Group for DC Public Schools. So there's more resources there if people want to continue to learn more, and please check that out. I'll leave it up to final comments from the panel, and then we'll wrap it up.
Well, I just want to say thank you, Salah, for reaching out and inviting me to be a part of the panel. I'm definitely truly honored to have served with you all on today, and to hear the questions and comments from those that participated. And I know that this will not be the last conversation. This will not be the last effort in trying to make DC and Ward 1 a better place and more safe for people. So I would just say and encourage everyone to continue having these conversations, take the information that was shared on today, talk about it with your friends, your family, your coworkers, those in your respective faith-based organizations, and just continue having these conversations, and just be on the lookout on how you can get involved, how you can submit, your ideas and concerns, and just know that it's going to take a community, a united front. So again, thank you all for tuning in today, and it was definitely my honor and pleasure to be on the panel tonight.
Thank you all for coming out, or taking time out of your day to spend with us and to listen to the things that we shared with you. Although we have been in this business of public safety for a long time, because it is a business, and in reality, it's our business, it's your business. But we want to say we do not have all the answers, and we have to be honest with that with you. We do not have all the answers, and it's going to take you to get involved. And like we said earlier, if that's having a small group, a small organization, or taking a good look at yourself, it's going to take all of us. And I'm here. If anybody need me, it's communityshoulders@gmail.com. It's Community Shoulders. Reach out and support your Ward 1 candidate.
Echo everyone's sentiments. I'm just happy to be a part of this. I think these are great questions and conversations. Let's build on this momentum. Thank you, Ms. Robinson, for dropping that contact. For folks who are looking in the chat, there's some really great information. We'll learn more about safe passage, which is really critical to making sure our youth are getting home soon and avoiding some of the crimes that take place outside the school, on the way home and to school. But looking forward to the next one.
Well, again, thank you to our panelists. Thank you to everyone for participating. I appreciate your friendship and your willingness to be part of this. And for everyone who's participating, this is not a one and done. We'll be having more of these, so stay tuned and check out your emails. And for everyone, be safe, and we'll see you soon.